So shall I just keep going, or but there was another person that's Kaz is here. Okay, so so apologies for that break, but hopefully we'll be able to pick up from where we left off. I was just about to say that in Africa, there is currently 54 million people with type 2 diabetes, which is estimated to rise to 60 million by the year 2050. And according to the research I did in the WHO region, of Africa, that works out, they say, at 10.5% of the population, which is higher than it is here in the UK, about
Mm.
nearly 4% more. So I just shared, well, what about our children? Okay, well, let me just get the PowerPoint back again.
What yes, did we join or host? We need to be hosting.
Need to be hosted.
So
So
what
it will
about our
kick us
children?
out again.
Yeah, so I think you have to host to your account.
Okay, am I okay to continue?
Yes, yes, please.
So what
Sorry.
about our children? Well, as I've shared already, with what's going on, what about the children? Well, the projection is that one third of the children who were born after the year 2002, which is 24 years ago now, right? They will die of type 2 diabetes and they'll die 20 years ahead of time. Across the world, we're tending to live longer, but that is going to start reversing as because of type 2 diabetes. And they'll be the first generation to die off before their parents unless we do something to stop the progression of the disease. So in this seminar, we're going to focus specifically on type 2. But let me just tell you briefly what the types of diabetes are, just in case you're not clear. Type 1, right, is a form of diabetes that's often referred to as juvenile diabetes. It usually has its onset in childhood, usually, not always. When COVID came along, my daughter, who was in her early 40s, got COVID and she's now a type 1 diabetic because a serious shock to the body can cause it to come on. But the immune system, as in, particularly in childhood, has become active against what's called the beta cells and in their pancreas, and it actually destroys them. And since the beta cells are what produce the insulin, then these diabetics are then no longer able to produce any insulin that they need. That's the type 1 diabetic. Then there is what's called insulin resistant diabetes. This is the beginning stage of the disease of type 2. And it's been estimated that it can be 80%, up to 80% of the population. And it starts many years before you develop the symptoms of diabetes. And by the time the symptoms appear, then significant damage could actually have already started. You also have what's called pre-diabetes. There are different names for it. Metabolic syndrome X, okay? Um, there are other names as well. This is where, in a sense, it's simply the person is becoming insulin resistant. There is also gestational diabetes. Somebody who's listening, you may know about this already because when you were pregnant and you were giving, raising a child, within your uterus, within your womb, okay? In pregnancy, a woman that's pregnant with her child can develop diabetes. It's like type 2, but it resolves itself once the baby's born. However, it's a wake-up call because it can mean that when you get older, within 10 to 15 years, you could become a full-blown diabetic, right, if you don't make changes to your lifestyle. And then finally, we have type 2, right? Adult onset diabetes. 95% of the population that have diabetes have type 2. So what are the symptoms? First of all, you may have pre-diabetes and not even know you have it, and you're having no symptoms, but yet you could be pre-diabetic. If you have as well a waist circumference of greater than 40 inches, 102 centimeters, right? Um, or a woman with a waist greater than 35 inches, 88 centimeters, you could be a pre-diabetic. If your triglycerides are over 2.3, you could be pre-diabetic. If your blood pressure is greater than 140 over 90, you could be a pre-diabetic. And blood sugar, elevated blood pressure, sorry, can actually be one of the first indications that a person is actually becoming insulin resistant. And that could be one of the reasons why so many people, have blood pressure problems today, because it is an issue going on in society as well, blood pressure. Also, if your cholesterol is greater than 5.2, you could also be a pre-diabetic. There are other things, okay? Hemoglobin, right? There's you may want to look it up yourself. You can find it online. I'll just show you this sheet I've got here, right? Without the camera blocking it out. That's just a list. It's a list there of what's called a HbA1c, and it gives a list of all the numbers relating to what your blood sugar levels will be. Maybe, Grace, we could post that later on some website, or you might like to send them out to people. But, we know now that eye damage can begin with a HbA1c as low as 5.5%, which is 37 mmol. Normal, on that chart there where you see the range, there's a green range, a yellow range, a red range. The yellow shows, the sort of slightly higher range. The green is the normal range, and it shows the number 5 to 5.9, okay, in the normal range. So, if you're on the normal range, which is really 20 to 4.41 mmol, or 5.5%, in medical circles, they often say that you are in good control. If you are below 6.5, then, that's not too bad. What we're aiming at, though, is not to be in control. We want to aim to reverse it. So we need to get that number, which you have when you have your blood sugar tested, down, right, to below the level where the damage is occurring in the body, below 5.5 if possible. Now, fasting blood sugar, if it's greater than 6 mmol, when you wake up and prick yourself, first thing upon rising, after you've not eaten overnight, then you could well be a pre-diabetic. Also, what's called polycystic ovarian breast disease, or systemic inflammation, inflammatory processes, a tendency to form blood clots. All of these things can be what can be described as indicators that you're a pre-diabetic. I've already mentioned gestational diabetes. Just remember that it is similar to type 2, and it occurs in pregnancy. However, up to 70% of these people will develop full-blown type 2 within 10 to 15 years. So if this happened to you when you were pregnant, it's important that you start to do something now, because you could be coming down with type 2 diabetes in the near future. So type 2 symptoms. Type 2 diabetes represents, as I said before, 95% of diabetics. The body is producing insulin, right? It's not like type 1 where you're not producing insulin. The body is producing insulin. But what's happened is your cells of your body have become resistant to it. And increasingly, what will happen, your body responds by making more insulin, right? So the insulin levels continue to rise until the body is no longer able to produce enough insulin to overcome that resistance in the body, right? And now then you develop the symptoms of diabetes. So the symptoms of diabetes are, first of all, no symptoms, right? You may not know that you got it until you go for a doctor, have a routine check, and they find out when you have a blood check that you've got diabetes. or you might be feeling tired, you know, all the time. You don't have the energy. You might have a thirst that's, you know, there all the time, even though you're drinking. You may find you're having to go to the toilet a lot, you know, emptying your bladder. Believe it or not, even up to every 30 minutes. Anytime that you as well have blood sugar greater than 11, you're a diabetic. If you have a fasting blood sugar that's greater than 7, that's been confirmed twice, then you are diagnosed as being a diabetic. And the complications of the disease, listen carefully, because these are the things that will happen to your body if nothing is done to stop it. 80% of people get heart disease, and 68% of those will die from that. As a diabetic, you're 2 to 4 times more likely to have stroke. Also, 67% of diabetics struggle with hypertension, which is a big word meaning blood pressure. 28% of diabetics will have eye problems, can suffer from eye blindness, and also diabetes is the leading cause of kidney failure. It can also impact your nervous system, causing what's called neuropathy, pain. It's characterized by a burning, stinging sensation in the hands and feet, which can actually spread into other parts of the body. And 30% of people who have this diabetes type 2 will have impaired feeling in their feet. And that can often lead to amputations, which of course is tragic, but it can happen very quickly. And in addition, there can be then mobility problems. You also can have problem with depression, 2 to 3 times more likely. Pregnant mothers with diabetes tend to have more complications with pregnancy, high rates of birth defects, spontaneous abortions. It can lead to what's called biochemical imbalances. We'll talk more about it at a future time, called ketoacidosis and hyperosmolar coma. And then there's diabetes can lead to being 2 to 3 times more what's called periodontal. Okay, that's to do with dental problems. Okay, and this brings us to another phrase, what's called diabesity. And that's a very accurate term to describe the syndrome because it begins with insulin resistance. And then it becomes what's called full-blown type 2, right? With the degrees of disease in between brought on by our lifestyle. So let's try to understand this insulin resistance. To reverse it, you need to understand what insulin resistance is. It starts in the cells of your body. And, you know, if I ask this question, I wonder how many people get it right. Your body has approximately 3 billion cells, and each of those cells requires energy to be able to function. Okay? They need what we call sugar, right? But of course, we're not talking about white sugar here, we're talking about glucose, right? For energy. And through this series, we'll use the term sugar or glucose interchangeably, right? But we're talking about the same thing, you know, this blood sugar that we need. But it's a common term used. And this sugar that we eat, of course, is broken down into the components that we need so that our body can use it to get energy. So the glucose, the sugar, is what the cells need to be able to operate. Our brain has to have it in order to be able to function. So as you take in a meal, the body then needs assistance to get that sugar into the cells of the body. In other words, to open the doors up of the cells to get it in. So I like to think about the cell membrane as a subdivision. You know, you're looking down on it from the air, right? There are thousands of little houses, you know, all these cells. And of course, as you look at a house, they've all got doors on them and windows, haven't they? And each cell has numerous doors on it, front doors, side doors, back doors. But the problem is all the doors get locked. Now, let's run through the scenario, what happens with diabetes. You eat a meal, The food comes down into the stomach, moves on into the intestines, and from there it then gets absorbed into the bloodstream. And as it gets absorbed, your blood sugar starts to rise. Now, under the stomach, on the left-hand side of the body, is a little organ called the pancreas. Okay? It's like a watchman that is constantly testing the blood to see if it's sweet. And when it discovers that the blood is getting sweet, it then sends out a signal to the little guys that are working down there to pump out insulin. And they're what's called islet cells that are located through the pancreas, and they empty into the microscopic reservoirs. And when those islet cells get the signal to produce insulin, they then squeeze those reservoirs, and that insulin gets then into the blood, right? So to deal with this big sugar rush. So your bloodstream carries that and the nutrients and the insulin to the cells. The problem is the sugar is circulating in the bloodstream and it can't get into the cells because the doors are locked. They need a key. So insulin comes along, it's the key. It unlocks the door of the cell, throws the sugar in, then locks things down and runs down the street to do it again in the next house. And then once sugar is in the cell goes to work to burn that sugar for energy. So this little picture here represents the furnace, okay? The cell takes the sugar, throws it in there, produces the energy it needs for body functions, and then any excess that's left over is then either stored as fat or is put in reserve within the cell, right, in what is called glycogen. And this cycle, which I've talked about here, represents the normal process. Eat a meal at the top there, right? Okay. Once the food begins to be absorbed, the blood sugar rises. The pancreas detects the rise in blood sugar. It goes to work and secretes insulin. And now the insulin that's been excreted into the blood stream is circulated through the body. It unlocks the doors. It throws the sugar into the cell. And as the sugar is moved into the cells, and the blood sugar then levels go back to normal. High blood sugar and insulin levels are actually toxic to our bodies. And when the blood sugar levels are high, you might think of it as actually being equivalent to the inside of your blood vessels being sandblasted. So it's important to bring those levels down so your body can return to your normal blood sugar levels. So now the cell uses that sugar and it receives, the energies it needs to be able to fuel its process, whatever it might be. And hopefully that sugar then will last until you eat your next meal. And then when you eat your next meal, the process starts all over again. What happens though when the cell has had enough sugar? What happens? Insulin is not asking if it can open the door. Insulin just opens. Insulin comes along and tries to open the door. The door won't open, right? It gets stuck in a sense. The locks won't turn. So you begin to develop insulin resistance cycle because you're gumming up the locks. When you eat a meal, the blood sugar rises. The pancreas responds by secreting more insulin. But there's more insulin in the bloodstream and there's fewer doors because they're getting locked up. The cells have been gumming up because they don't want any more sugar. So they take the excess sugar, they continue to store it, using more of it to stick up more locks. So there become less doors for the sugar to get in. And that cycle just goes round and round and round and round. And eventually what happens, the pancreas gets tired out. Then when you come along to put the sugar in the cells, the muscle and the fat cells are all gummed up. The insulin production is maxed out and your blood sugars begin to rise. and your doctor says to you, you've got diabetes. So type 2 diabetes is an insulin resistance syndrome where energy intake over a long period of time, sometimes as long as 20 years, is in excess energy is in excess of energy that you're spending. And that excess of stored energy messes up your metabolic cycle in your body. There are things you can do about it, several things in treating it. And by far, most effective way is what we call diabetes self-management. Okay. Education, which is what we are doing here in this program, teaching you how to manage your diabetes. But you know, it is 10% doctor and 90% patient. So don't forget that. You know, if you got a problem with diabetes, keep your doctor informed as to what you're doing, you know, so they can monitor what's going on when you are and begin to make some of these changes we talked about. The second most important thing to do is diabetes self-management support, right? Get involved with, you know, like we got here, a group that gives you support. Help other people to learn from this course how to reverse the control and control this disease. And the third most important thing is to seek medical treatment. You know, I want you to understand as we begin to close, this program is for educational purposes. It doesn't take the place of your doctor. You're responsible for going to your doctor, allowing them to work with you to manage your medications that are based on your symptoms. So inform your doctor that you are working to change your lifestyle, like increasing your exercise, making dietary changes, right? And get their approval. They will be happy, I'm sure, for you to do that and help you to do that. You know, but changes in your activity level or diet could impact the medications if you're on them from the doctor. So keep your doctor informed. You know, really going to the doctor ought not to be the first line of treatment, but it ought to be modifying our lifestyles so that the problem never exists in the first place. Medications and insulin are just in the doctor's toolbox to help you to control your symptoms. He cannot reverse your disease. Only you can reverse it. So if you continue in the same way, if you don't make any lifestyle changes, then what you can expect is an ever-increasing regimen of medication, and you will begin to experience more of the complications that I shared earlier. So only you can reverse diabetes. This slide here just shows some of the medications that the doctor might give you. Okay, some of you might recognize some of those, and you know we'll talk more about those, or you can ask questions about them at future programs. But you know, they work for a while, but when the cells have had enough, what happens when that stops working? You start to have injections instead. Okay, the medications can help, but they will not cure it. The lifestyle, when that means to change it, that will begin to reverse it. So unless you take charge, you are not going to get any better. You know, your doctor can treat your symptoms. They can advise you to lose weight. They can advise you to eat less. They can advise you to get more exercise. But that advice does little good unless you do something about it. Right? The choice ultimately is up to you. What will you start to do to make a difference so that you can start to reverse the problem that your body may be under at this time. Grace, I'll stop there. I don't know if it's appropriate, if anybody has any questions they want to ask.
Yeah, thank you very much. So if anybody has got questions, you can ask now if you want more clarity, or you can write them down, drop them in the chat box if you want something. If you didn't understand something, or we can send you the slides in not the actual slides, but we can send them to you. A copy
We have
of them.
we have some summary sheets we can send out.
Yeah, we have got some summary sheets. We can send them to you. It's a lot of information to take in one day. So we can send you, if you text us or inbox, which inbox would be the best? Pastor, do they have you?
Yes. Yeah, put it in the chat.
Okay, so if you look in the chat, Mpaso is our technician. He will respond to all the queries, and we can send you the information which you require. But there is also a worksheet which we can send you at the end of this program. Every week, there'll be a different topic. It will be about diabetes, but it will be a different topic. So if you want to be on top of it, you have to do your homework this week. There is a homework paper on the chat, which you can use. But every week you'll be getting a different worksheet. So try and keep up to it. It's like revision. We'll start by revising the questions which you have got this week. The next week you get a different one on the topic we'll be presenting next week.
Next week we'll be focusing particularly on sugar. We'll be talking about carbohydrates, and we'll focus sugar particular. The week after that, we'll continue with carbohydrates, looking at also at leptin and insulin. Then we'll go to talk about fats and proteins, and then as we get to session 6, we're looking at inflammation and oxidative stress. And then in session 7, we're looking at what's called epigenetics and numbers and diabetes. And the last session we'll be there looking at, well, how can we maintain a healthy lifestyle? Bringing it all together.
Thank you so much. So the message was only you can reverse the diabetes. Only you can manage your symptoms. The doctor can help you, but you have to take charge, take responsibility. If you want to reverse it, it's only you that can reverse it, but what you're doing, what you're eating, and your attitude as well to the condition. So don't forget, you can text us, you can write questions. If you've got questions, send us those questions. We'll try and answer them. And next week to be a different topic. So this week we are dealing with it's like an introduction to type 2 diabetes. Please get weighed if you haven't been weighed, and then get your insulin levels, the measurements. We want to know what you're starting with and what the measurements will be at the end of the program. But we need something to start with. Anybody listening on the online, anybody's got any questions? You can raise your hand or you can ask a question now.
Okay, so hopefully what we shared in this first session gives you now a little rough idea as to why you're a diabetic, or
Yes.
why you are a pre-diabetic, or even waking you up to the fact that, you could be a pre-diabetic and you don't know it because of your lifestyle. And, gradually as we go through each program, it will hopefully help you to recognize areas in your lifestyle where you can make changes so that you will have the opportunity to either reverse diabetes or not catch it in that regard.
So thank you very much, Paul, for that presentation. And we hope you join us again next week, and tell your friends if you know anyone who is type 2 diabetic, they can join us. It's not too late. We've also got about 8 more lectures left. And then some people will be asking, what shall we eat? What shall we do? So in closing, we have a little demonstration of things you can have for breakfast. Today we're showing you what you can have for breakfast. Mpaso has done a little clip for us. And then just encouraging you, if you don't know what to eat, today's presentation will help you to decide, you have to change your eating habits as well. So watch this clip if you want to know some tips for breakfast ideas. We're going to show you now. Okay. You're going to post it on here?
Can you see my screen? Are you able to see my screen?
Yeah.
Can you hear the
Yeah. So this is maize meal porridge. We can get maize meal everywhere. This is the recipe.
Just wait. I think
Yeah.
the voices are crashing.
1 cup maize meal, 2 cups soya milk, or you can use ordinary milk, preferably fat reduced, 2.5 cups water, 1/2 cup desiccated coconut, and 1 cup dates, just to sweeten it instead of sugar. So it's a simple, quick breakfast recipe. 1 cup maize, 2 cups milk, and then the dates. If you can't get the dates, you can use maybe brown sugar, or try and change your taste buds. You can have it without sugar. That would even be better. What's that? Yeah, so the dates are to sweeten the porridge, but you can substitute any fruit, dry fruit like raisins, any dried fruit would do to sweeten your porridge, make it palatable. And we said maybe instead of coconut, you can use pounded peanuts. I don't know if we have a local name for that, but pounded peanuts, the powdered form, you can use that. They've got protein, they've got a bit of fat, natural healthy fat. So you can use pounded peanuts in the porridge instead of coconut, if coconut is the problem, if you can't get coconut. Any milk you can get locally is fine. Or you can make your own milk. We got some recipes where you can make your own milk as well. So these are examples of the things which are locally available in the shops: Nutri-Milk, soy milk. The best milk would be skim milk, the one that hasn't got any fat in it. As you can see, the ingredients, you have the maize meal, you can have a banana to sweeten it. So we have the recipe. So if you follow the recipe, mix the water with the maize meal, cook it for a few minutes to cook the starch, and then add the other ingredients after. We can send you the recipe as well. If you're watching and you want the recipe, drop us a line. We'll send you the recipe. These are the nuts we've used: peanuts, I don't know what the other name for peanuts is. Or ground nuts. So you can use that. And then after eating your porridge, you can go for a walk. Exercise is good. There you see the porridge cooking. Just takes a few minutes really to make this porridge. Try it and let us know what you think. And you can try sweetening it with different things as well. But the most important thing is that you have to change what you're eating, change your diet in order to reverse type 2 diabetes. Thank you very much for being with us today. Any questions before we finish?
Well, I wish you all God's blessing as you begin to make the changes that each of these programs will bring for you. Thank you for joining us. See you another time.
Yeah, thank you very much for the presentation, Paul. And don't forget, send us questions. You can contact us anytime. If you got our contact, send questions if you have questions. But we'll see you same time next week and Sunday afternoon, 4 p.m. to 5 o'clock, 4 or after 5, as it goes. But we'll be here for the next 10 weeks presenting this program, Reversing Type 2 Diabetes. Invite your friends. If you know anybody who is diabetic, please encourage them to join us every Sunday afternoon. And we just want to say thanks to Pastor Paul Haworth for today, for the presentation today. And thank you for those who have joined us online. See you next week. Bye.